How important is checking the patient's understanding in the OET speaking exam? And did you know you actually gain more marks simply by doing this, by checking the patient's understanding? And isn't it just as simple as saying, do you understand? Or is there something more? Well, in fact, the answer is yes, there's quite a lot more to that. Check out today's video, the OET speaking test. If the patient doesn't understand, neither will the examiner. So, checking the patient's understanding. What does it mean? What does it mean to check the patient's understanding? Well, this is really about making sure that any information that you give to the patient is fully appreciated and understood in a meaningful way by the patient themselves. So this means that they understand what to do with the information once you've given it to them, or whether it implies that they have to take some form of action, or whether it's simply for information purposes. So the first question to ask is, when do we do this? When are the opportunities in the role play to give information and check the patient's understanding? And that's the key. Really, whenever we give information, we should be thinking about whether we need to check the patient's understanding. Sometimes we don't need to bother about it because the information we've given really is either a repeat or just very, very minor, that it can be reasonably assumed that the patient has understood and that we don't really need to check the understanding. But there are key points in the role play during the conversation with the patient where it would be appropriate to check whether the patient has understood. And there's various ways we might check that the patient has understood. So the very, very first time that you need to think about checking the patient's understanding really is when you offer a diagnosis. This is really the first time where you're giving information that needs to be verified. You have already given some information. In fact, you've told the patient who you are. You've told the patient that you're the doctor or the nurse or the physiotherapist. But that's kind of obvious, so you don't need to check whether they've understood who you are and what your role is. But the first time when it's really important is during the conversation about the patient's symptoms, where you discuss the diagnosis. So having done the questioning, maybe having examined the patient, you now reach the point of saying what you believe the diagnosis to be. Now, one thing that's worth making clear here is whether you use technical medical jargon or simply everyday language. And the advice is always to start with everyday language. Now, in the example of this role-play card, again, we're on role-play card number 19, and the diagnosis is croup. Rather than going in directly to a medical explanation of what croup is known as medically, and also the various treatments, etc., the first question you need to ask is to check the patient's understanding of what they know about croup. Now, there's two things here. There's the phrase itself, do you know what croup is? And the real second part of this is, does the patient know anything about what causes the condition or how it's treated? The patient may respond with no, maybe, or yes. So let's imagine the patient says, no, I don't know anything about croup. I've never heard of it. Well, of course, the answer, the simple answer, is already in the role-play card, and this is what you should follow, that croup is an infection caused by a virus that causes swelling of the windpipe, the airways to the lungs, and the vocal cords. Simple answer, and isn't time-consuming. What if they say maybe? So, in other words, they might say, yes, I've heard of it, but I don't know what causes it. Well, again, you have to follow the task that is explain what croup is. That's the task. And again, you offer an explanation. What if the patient says, yes, I do know about croup? There is a task in the role play that tells you to explain what croup is. But what the role play doesn't say is whether the patient has already got an accurate knowledge. So it's a slightly different approach. So imagine this. Do you understand what croup is? Or have you heard of croup before? Yes, I've heard of it before. My sister used to have it when we were young. Ah, right. Now, what you will then do is briefly summarize again the explanation of what it is, because this is a task that you have to do. Yes, so Richard, you're aware that it's a virus, and you're aware that it causes a swelling of the windpipe, the airways, and the vocal cords. Is that right? Do you see the point there? You're still checking the patient's understanding, but you're checking the accuracy of the understanding. You're checking the level of detail they know about, in this case, croup, your diagnosis. So just be careful. When the patient says, yes, I know about it, don't simply skip over the task, which is, in this case, to explain the diagnosis, or in this case, explain what croup is. Still go ahead and summarize. It's quite appropriate to do that. That's why it's called checking the patient's understanding rather than listening to the patient's understanding. The next point where you need to check the patient's understanding is when you offer some form of treatment plan. Now, you may go through an offer of some medication, some drugs. You may go through an offer of referral, where you refer to a specialist, or you may simply advise certain activities that the patient should pursue in order to solve the problem, like exercise or dieting for weight loss, etc. But at this point, you really need to be checking, does the patient understand what you've told them? So in other words, you can do 2 or 3 things. So let's imagine you've explained it's medication or a treatment plan or simply some advice. You might say about the medication, do you understand why I'm giving that medication to you? Does that make sense, what we're trying to do with that medication? Or let's imagine it's a specialist. Yes, I'd like to refer you to a specialist. And do you understand why? Does that make sense that I'm referring you to the specialist because they will be able to treat you better and they will have more accurate knowledge? Does that make sense? Do you see what I mean? Again, you've explained things to the patient, you've explained what your action's going to be, but you're checking that it made sense to them. This is another form of checking the patient's understanding. In the final example of when you might check the patient's understanding is actually at the end. You've probably covered quite a few bits of information that you need to make sure that the patient has understood. So one way of doing that, and we have discussed this before, is to ask the patient to summarize their understanding. Bear in mind, throughout the conversation, you may have offered a diagnosis, in which case you check what they already know. So that's kind of a small version of checking the understanding. You may offer a treatment plan or some advice. And again, you may check that it's okay with them, that it makes sense. Do you understand? And again, that's a smaller way of checking the understanding. But one final way that you might do that, as we've just said, is to get the patient to summarize their overall understanding of what you've discussed. So you might say something to the patient like, well, Richard, so we've covered a lot of information today. I just want to make sure we're on the same page. Would you just give me a brief summary of your understanding of what we've talked about? So this is a broader question, and the patient may well say something like, oh, okay, doctor, yes, you think my daughter's got croup. That's the first thing. You're going to give her some medication to help reduce the swelling and the inflammation, and you've also given me advice if she turns blue to make sure that I'm aware that that's quite a serious situation. Yeah, have I covered everything, doctor? Yes, absolutely. Well done, Richard. And don't forget about that follow-up appointment. Do you see the benefit of asking for a summary of their understanding? It makes sure that the major things that you've talked about have sunk into the patient's mind. And the extra benefit is it gives the patient, or you rather, an opportunity to identify any gaps in the patient's understanding. In this case, the patient forgot that there was going to be a follow-up appointment. So do you see the sense? At the end of the conversation, it's a good idea to ask the patient to summarize. Now, the other benefit, of course, is you are simply gaining marks for checking the patient's understanding and getting that understanding, but you're also proving to the examiner that you've actually done a good job of giving information. Clearly, you've done a good job if the patient is able to summarize them back to you at the end. So I hope that really makes sense. They're the main areas for checking the patient's understanding. The only one I would add to that is the little bits of gathering information or checking the patient's understanding that you might apply throughout the conversation. And there are times when you've explained something smaller and you might just simply say, does that make sense? Do you understand? Do you have any questions? Do you see what I mean? Simply by asking, do you have any questions, you're still checking the patient's understanding. So they're the major ways and a couple of the minor ways we check the patient's understanding. So I hope that made sense to you today. I hope it was of some value. Let's do a quick recap. Today we covered the overall subject of checking the patient's understanding. And we covered things like why it's so important for the exam. Specifically, you'll remember that we discussed when initially giving the diagnosis, check whether the patient has understood the terminology that you're using. They may not understand it. And check what they already know about that situation, about their condition that you've diagnosed. And then there's, after explaining the diagnosis, check whether they understand the diagnosis that you've given them. And then another point is check if the patient has understood what's required of him or her and why. For example, check if the patient understands why the treatment plan is of importance to him and how it's really important to follow him, and perhaps even the risks of not following it. Check if the patient understands the key points of the discussion by asking the patient at the end of the conversation simply to summarize their understanding. And that will gain you extra marks in many ways, as we've discussed. So again, great speaking with you today. As I've said before, I really hope this helps. As we've said, we're really trying to progress with these videos to give you as much help as we can to pass the OET speaking exam. If you really want to max out your chance of passing the OET speaking exam, by far the best way of doing it is to have a one-to-one conversation. I can take you through a mock test under exam conditions where I can then focus in on the specific skills that you may need to do some work on, and maybe even give you some tips and tricks that will help you pass the exam and hopefully gain more marks as well. Can I ask please that in order for us to keep providing these videos, can I ask that you hit the subscribe button, also hit the like button if you would, and that helps us with the YouTube algorithm. But finally please, can I ask that you hit the notification bell, and this will make sure you keep getting information about new videos that we're bringing out. So in our next video we're going to talk about what questions to ask, how to ask them, when to ask them, and perhaps times when it's best not to ask questions. So join me in that next exam. I look forward to seeing you then. Bye for now.